Good evening, everyone. Thanks for joining our Men's Health webinar. We're excited to have the opportunity to share the important men's health education with the group tonight. I'm Preston Brickner with Boston Scientific Urology. I'll be the host of tonight's event. Just want to start us off with a couple quick housekeeping items, and then I'll turn it over to our speaker. Most importantly, your participation tonight is completely anonymous to all the other attendees. No one can see your face nor your name. Any questions you'll ask can only be seen by myself and our speaker. We encourage interactive presentations. So if you have a questions, just type it into the chat box. It should be at the lower part of your screen. At the end of the presentation, we'll get to as many of those as we can. Tonight's webinar will be presented by Dr. Devang Sharma. Dr. Sharma is a comprehensive men's health specialist with fellowship training in male infertility, sexual dysfunction, and reconstructive surgery. In addition to general urology, his practice is focused on men with urinary complaints related to the bladder, prostate or urethra, erectile dysfunction, Peyronie's disease, low testosterone, fertility concerns, and prostate cancer survivorship. Dr. Sharma was born and raised in Montgomery County and graduated summa cum laude from the University of Maryland with a degree in bioengineering. He graduated with honors from the Geisel School of Medicine at Dartmouth, then completed urology residency and andrology fellowship at the University of Virginia. Dr. Sharma, I know your time's in high demand. Thank you for your time. Why don't I turn it over to you?
Awesome. Thanks so much, Preston. I appreciate it. And I want to welcome all the attendees who are tuning in live tonight. And I also want to welcome everybody who's, tuning into the recording. I think this is a really important next step in the journey of learning more about men with leakage, urinary incontinence, specifically after prostate treatments, and what we can do about it. This is near and dear to my training, my fellowship, and what I do on a regular basis in the office, taking care of not only prostate cancer survivors, but men who have gone through various treatments and, end up with less control with their urinary patterns than they did previously. This is a really helpful slide. So we have an abundance of resources available to us, and this is one of the best ones. If you can take a screenshot of this slide, this will really help open the door to a lot of educational material. You can use the QR code here on your smartphone and take a look at all of the information that's presented in this slide and more, patient testimonials and more information about how to take the next step in the journey for treatment. Let's start out with just laying the foundation for what we're talking about tonight. We're going to be focusing mostly on stress urinary incontinence. That's the medical jargon definition for men who have leakage that is associated with activity. So you can be talking about laughing, coughing, sneezing leakage. You could be talking about leakage or loss of urinary control that occurs with just changing positions. I'm fine when I'm sitting down, I'm fine when I'm sleeping in bed, but as soon as my feet hit the floor, all of a sudden it seems like the floodgates are open or there's leakage that I have no warning of. This is probably more common than people realize. It's because, we men are pretty private about these things. I think women do a much better job than we do about being open about medical conditions and things that can occur. A lot of that has to do with just leakage being a little bit more normalized for women because it happens so frequently after pregnancies and after childbirth. For men, this is largely related to accidents, injuries, things that we don't talk about necessarily on a regular basis, maybe radiation treatment for cancer or prostate treatments for benign enlargement and blockages, or most commonly for prostate cancer. So this is not exactly locker room talk or something that you chat with friends about when you're out, but this does affect a number of men. There are estimates out there, approximately 500,000 men who suffer from this worldwide. Let's learn more about the actual process and some of the details of how this can occur. It's really important to just understand how our body's supposed to work before it gets messed up, right? So this is a helpful slide. This is a man standing upright, facing to the left of the screen, chopped right in half in the middle. This goes over the anatomy that's important for us to understand. You can see, hopefully my cursor here, this is the bladder. This is a sac, but it's also a muscle that should collect the urine and keep it in our bodies until we're ready to get rid of it. Our kidneys are constantly filtering the blood. As it does that, All of the things that are unnecessary and should be excreted are produced as urine that drops down from the kidneys, just like funnels into the bladder, where it's supposed to sit there and rest comfortably until we're standing at a urinal or sitting at the toilet. Once that occurs, there is a natural response from our body that allows the plumbing to naturally open up and the bladder, which is the pump, to squeeze and empty the urine completely. The urine passes through the prostate, which sits right here. A lot of people are very confused by the prostate. What is it? What does it do for me? Why do I have it? Why does it cause so many problems? Basically, there are two things that come out of the penis. There's urine and there's semen, but they come from very different places. They both connect to the penis via the prostate. The prostate is basically just a Y connector that's hidden way back behind the scrotum or ball sack. And that's something that we can feel with a digital rectal exam in the office. That's how most people are familiar with their prostate is, oh yeah, my doctor feels that once a year by putting a finger into my bottom side to feel it. So this prostate is actually helpful in a lot of ways also, because it's technically our first line of defense to keep us dry. When we're going about our regular business, part of what is holding the urine inside of our body is our bladder neck, or this part of the prostate. When that is disrupted from surgeries, from radiation, from traumas, then that can really impact the degree of control that we have over the urine. We'll get back to that more later. Now, after the urine passes through the center of the prostate, it hits our sphincter. So when you are quickly stopping your urination before a leakage, or if somebody walks in while you're peeing or whatever it is, you're writing your name in the snow or something like that. This sphincter is what gives you voluntary control to start and stop things. This is also something that can be affected, again, by injuries, by radiation, by treatments that we provide for people who have certain conditions like benign prostate enlargement or prostate cancer. The sphincter is something that we have control over, so that is something that you can work to strengthen with pelvic floor exercises and physical therapy, but this is something that normally we relax completely to, again, allow the urine to pass through unimpeded. It then travels through the back of the urethra, which travels behind the scrotum, and then through the shaft of the penis to the outside world. So this anatomy is something that we'll go back to when we talk more about what happens when men have loss of urinary control. These are some of the causes that I had already alluded to. The vast majority of men who experience leakage, it's after prostate treatment for cancer. So when men have prostate cancer, I don't have to explain this to a lot of the survivors who are in the room now, but prostates are removed. That's often done with minimally invasive surgery or a small incision at the bottom side of the abdomen. But the entire prostate is removed. And again, that impacts our first line of control, keeping us dry as men. There's also some neurological conditions that can cause this type of leakage. So men who have multiple sclerosis, spinal cord injuries, that can impact some of the involuntary controls and communications that happen between the brain and the bladder, because this process of the bladder being chill when it's supposed to, squeezing and emptying your bladder completely when it's supposed to, is all under the involuntary control of your brain and your spinal cord, which can be affected by various conditions. Surgery for enlarged prostates, BPH surgery. So the tried and true is the TURP or the Roto-Rooter that people are very familiar with. We've gotten more and more sophisticated in the way that we treat benign prostate growth and enlargement. There are procedures that are called robotic assisted laparoscopic simple prostatectomies, which are really neat procedures that can be done through the abdominal cavity to core out the obstructing parts of the prostate with robotic assistance. There's something called a HOLEP, which is a holmium laser enucleation. That's basically like removing the mass majority of the prostate tissue through a small camera that goes in through the penis. Those are great procedures for those who need it, but they also do sacrifice urinary control in some men who undergo those, and those are the men who are tuning into this meeting tonight. Radiation can have an impact also. What a lot of people don't realize is the effects of radiation are not immediate, right? They're expecting like, oh, I got through fine, I didn't have a whole lot of issues, but sometimes the effects of radiation can accumulate over time, meaning you had radiation to treat prostate cancer. Maybe the first couple of years were fine. We call that the honeymoon period. And then after that, 3 years, 5 years, 10 years, 15 years later, things do change, and that can impact your degree of urinary control. Pelvic trauma is the last thing here that's more pertinent for our active service duty men and people who have had straddle injuries. So if you've had men who have had reconstructive surgery because of major injuries that occur after catching handlebars between the legs, that can lead to issues with disruption of the urethra that require surgery to get repaired. Remember, that's in that area where we have control from our sphincter. When that gets injured and reconstructed, that compromises our control. So this is a slide that mostly just talks about what the impact of leakage is, right? Because the leakage itself is not going to be limiting to your life. Leakage doesn't kill people, but leakage does have a very, very dramatic impact on quality of life. And I think this is particularly true for men, because again, us men, we're not as open with this condition as women are, and it can be extremely isolating. I'm a survivorship specialist for prostate cancer patients. I see this on a regular basis in the office. It can be incredibly isolating. I've seen men who are depressed, they're socially withdrawn, they're not doing the activities that they want to do because they're planning and they're avoiding things. They know, I don't want to put myself in a situation where I'm embarrassing myself or I'm embarrassing loved ones or family members because of loss of urinary control. It can be an incredibly dramatic thing that changes people's behavior, changes people's self-confidence, self-image, and it's something that really we should be focusing on treating. We're going to talk a little bit more on how prostate cancer treatment can lead to issues with urinary control. So this is going to go back to that anatomy lesson that we reviewed previously. Radical prostatectomies is the complete removal of the prostate for prostate cancer. It's an incredibly common procedure. We have partners that do this on a regular basis at our community hospitals. It's an overnight procedure where patients are discharged typically the next day with a Foley catheter for about a week. Now, after that procedure, there is a pretty significant amount of recovery that happens, and we're going to review why. Remember, the prostate is a connector that connects the bladder and the penis. And when the prostate is removed for cancer purposes, there is a hole that needs to be reconstructed. So the bladder is no longer connected to the back of the penis, and this has to be sewn back together. That removes the first line of defense that keeps men dry, which is that connection between the prostate and the bladder. Another thing that contributes to that support and that coordination between the brain and the bladder are these peripheral nerves. These yellow things that you see here are the nerves that are caked onto the surface of the prostate. Now, again, we've made a lot of strides in the way that this used to be done. Most prostate removals nowadays, there are at least attempts made to spare these nerves because we know that they're important to men's sexual health and to men's continence. But even in a nerve-sparing prostatectomy, the prostate has to be peeled off of these nerves. And even if they're still intact, as you can see here at the bottom of the image, they're not as healthy as they were when they were attached. Imagine your foot falling asleep and never waking up. It's called a neuropraxia, and that can occur after a prostatectomy, even with a nerve-sparing technique. When those nerves are not able to transmit the signals from the brain and the spinal cord to this complex anatomy, that again can compromise control. So what can men do about it? I think it's important that we talk about this in detail because there's a full range of treatment or management options, and there's a little difference between the two. So what we've touched on already is that sometimes men just avoid situations in which they leak. So they are reducing fluid intake. They're really scared to drink like they normally would because they know that that can worsen their issues with control. There are men who are really reluctant to take some high blood pressure medications that are important to preventing heart attacks and strokes because some of those high blood pressure medicines are diuretics. They make more urine and they contribute to this issue of loss of urinary control or leakage. So men are reducing their fluid intake. Men are being a little bit more, reluctant to take some of the medications that are important for them to stay on. Another thing that we see men doing on a regular basis is just planning their day around a bathroom, right? a lot of my patients, they know where every bathroom is in every building they've ever been to. They think about using the bathroom before they get into the car, right after they get into the car. And these are learned behaviors to try to work around the problem that a lot of my patients are having. These are behavioral modifications. And to a certain degree, they can be helpful, right? Like if you drink a ton of fluids and hold your bladder for a really long time, you're asking for trouble, right? So there's a fine balance here between being neurotic and avoiding things that you should be able to do normally and just not being a knucklehead and doing things to actually help you out. So as far as interventions, things that we can actually do to improve the condition, everybody should be aware of what pelvic floor physical therapy is. This is an incredible resource. We live in an area we have access to very, very high quality pelvic floor physical therapists that can help men who have urinary control issues with improving their condition without surgeries or medications. It's really just with a strengthening program to help with the part that we have control over, right? We talked about there's the first line of defense, which is the connection between the bladder and prostate. The second line of defense is the voluntary sphincter, is that muscle that we can clamp down on to help hold the urine inside. Now, sometimes that's not a muscle that we're used to strengthening. Most guys don't realize that they have a pelvic floor, they have muscles down there that can work in getting stronger. Well, these pelvic floor physical therapists, they are really the doctors or the PhDs of the muscles of our body. And pelvic floor physical therapists, particularly, are like the subspecialists just for the muscles of the pelvis. Even on top of that, there are pelvic floor physical therapists who specialize in the male pelvic floor because it's very different teaching a man how to do these exercises than it is to teach a woman how to do these exercises. So please talk to your doctor about getting plugged in with a good pelvic floor physical therapist and starting a regimen where you can do exercises on your own to improve your control. That includes Kegel exercises, which you can read a little bit about, but again, most of us have a hard time reading a description of a Kegel and figuring out what the heck does that actually mean and are we doing it properly? That's what leads to this next bullet, which is called biofeedback. So that's a cool trick that a physical therapist can use inside the office to help you understand if you're actually squeezing a muscle properly. So sometimes it's funny diagrams, sometimes it's animations or cartoons, but basically the rationale is you will get some type of visual feedback when you're actually squeezing this muscle properly. So in the same way that we use stickers to put onto your chest to do an EKG, and that gives us a pattern of electrical activity for your heart, a pelvic floor physical therapist can do something similar for the muscles of your pelvic floor and can give you visual feedback when you're squeezing the right muscle. This is something that I leverage also when I'm doing office evaluations for men with leakage. I want to understand why the problem is occurring, and part of that is a good evaluation of the sphincter, and I can do that with a camera to actually see if the sphincter is closing or opening, and that's biofeedback. Now, there are coping mechanisms. So if you do everything that you can, you've done the exercises, you've done your bathroom mapping, like where everything is, and you come in with a plan to minimize the leakage, oftentimes, you can do all of those things and it's still not going to be enough. So you have to be able to manage or cope in some way. And that's where incontinence products come in. There are safety liners that are just in case thin things that can help prevent basically staining of the clothes so that you're not seeing things that are leaking out. That's okay for a very minimal amount of leakage. There are more formal pads that are thicker and more absorbent that can hold a lot more fluid for men who have more kind of mild to moderate leakage. And then obviously there are male incontinence briefs. There are brand names for these that you'll see in the drugstore and the grocery stores. The aisles now for these are enormous because that just shows you how common this condition is. People are sitting there shopping for this stuff in their local grocery store instead of making appointments with their doctors to actually get these things treated. But it's essentially adult diapers for men who have really moderate to severe amount of incontinence or are looking for really the greatest degree of coverage to help prevent situations where they're being embarrassed. Catheters. When we talk about catheters for stress incontinence, we should really be talking about external urinary collection devices. So, you can search a lot of these things online nowadays. You can find some cool and clever devices on Amazon that basically catch very large amounts of urine that can spill out involuntarily into a drainage bag. So there's a picture of this here where a man has actually got something that looks basically like a condom on his penis that's connected to tubing that will drain any of the urine that leaks out of the penis when it's not supposed to into a bag that can be concealed underneath the leg. Now, obviously, that is not ideal, right? These bags can leak. They have to be emptied on a regular basis. Wearing shorts is kind of off limits when you have a situation like this, but this can be a helpful coping mechanism for people who have a volume of leakage where diapers is just really not practical. Penile clamps is also something that men should be familiar with. That's what's this image over here. This is really like a medical grade chip clip to break it down to something that is quite simple, but this is designed to be able to more or less comfortably and safely occlude the urethra by just clamping onto the shaft of the penis and literally mechanically holding the urine inside the body for short periods of time. So this is an okay coping mechanism for men who really want a high degree of certainty and confidence that there's not going to be leakage for short periods of time, right? So business meetings, important dinners, going out for movies, that type of thing, but really not for full day use. For men who are looking for more long-term solutions, we want to be looking at the surgical options, right? A lot of times the leakage is happening because of mechanical problems, right? Mechanical disruptions that have occurred as a result of treatment of other medical conditions, whether it be surgery, whether it be radiation, whether it be reconstructive surgery after injuries. For men who are not content with just changing their behaviors, doing some Kegel exercises and learning to manage with incontinence products, you want to keep an open mind to the surgical options that are available, because the reality is that we have access to two great surgical options that can be fit to meet the needs of men who have varying degrees of leakage and varying degrees of underlying causes of leakage to arrive at more long-term solutions. We'll start with the male sling. A male sling is a minor outpatient procedure. It involves the placement of a small piece of mesh that your body can accept and incorporate into your pelvic floor. It's a minor outpatient procedure. Once it's in your body, it is completely undetectable to other people. Nobody would know that you would have had this procedure based off of scars or based off of, feeling devices or anything like that. It has a very high rate of success in getting people a degree of control that they can live with and be confident with if they have a mild to moderate amount of leakage. And we can go into more detail about what that means later. Most patients who have this procedure will see benefits immediately. When you place a sling, as soon as a catheter is removed in the recovery period, you are at least 50% drier than you were previously. A lot of men are reaching levels of continence that can really be confident with after a procedure like this. There's not anything that you have to do to get this thing to work. This is done completely by the surgeon and by the placement of this very high quality material. After that, it just works from the minute that you wake up. The satisfaction rates are quite high. 92% of people who have had this procedure would say that they would do it again. I want to show you a picture of exactly what this is. So people hear mesh, and there's a lot of information about mesh. Mesh, depending on what is used and where it's used, can cause different reactions in the body. The reality is that we've been using mesh materials for years and years and years. Mesh is a really critical and important tool for hernia repairs. Mesh is really critical and important for incontinence surgeries, and it's really the gold standard because all it is it's a scaffolding, okay? This material is the same material that stitches are made of. It's just made into a mesh or lattice system that looks like a strip of paper, but it allows the body to heal into it and actually make it a more permanent solution for people. This is placed behind the scrotum or ball sack. So this image here can be a little bit confusing, but this is your pelvic bone. So this is a view of a man using 3D or X-ray vision where we're standing at the feet and we're looking up at a man who's lying down. So this area of muscle here is actually the pelvic floor, which are the muscles that hug the base of the penis and the scrotum in this area. This white strip here is a piece of mesh that supports the backside of the urethra downstream or further away from the body than where the prostate is or would be, and then supports into the inner thigh or the pubic bone here with these little arms that hide discreetly. Again, you can't see any of this from the outside. It's all internal, and it basically helps provide a degree of support so that if there's an issue with your first line of defense and your second line of defense is not strong enough, this is your third line of defense that really helps give you the degree of control and continence that you need. Now, the other surgical option is the artificial urinary sphincter. This is actually the solution that's considered the gold standard. So this is the best incontinence procedure that we have, which means for guys who really want the highest degree of confidence or control, or guys who have the most amount of leakage, this is probably the best option for them. It is a little bit more of a complex system, and we'll go into that in the next slide. But basically, this is a tried and true system that provides control in a way that is really discreet. So it is not detectable to the naked eye. It does involve a more mechanical system that you interact with by squeezing a part of the body to allow the mechanism to work. But this is a device that mimics the natural function of the sphincter more. So again, I'm going to go back to that original anatomy lesson. When we're at rest and we're going about our regular business, our body is doing things to help hold the urine inside. We're not aware of that. We're not constantly squeezing our muscle to prevent urine from leaking out. It does it by itself. So in the same way, an artificial urinary sphincter is holding the urine inside the body by itself without any input from us on a regular basis. The only input that's required is that when we go to pee, you interact with the device by giving it a couple squeezes, and that opens to allow you to urinate normally. So men who have actually a weakened or a non-functional sphincter, which again is something that I evaluate on a regular basis in my men who have leakage, that is a great option because again, this provides you with a new third line of support that's more sophisticated, more dynamic, and can open and close in the same way that a urethra normally would. So this is the actual device. You can see it here in yellow. This yellow is actually an antibiotic coating that's baked in from the factory to help reduce the risk of implant infections. Anybody who's had a knee surgery or a hip surgery knows that surgeons get very, very particular and uppity about preventing implant infections, like using antibiotics before procedures and things like that. You know, Boston Scientific has done an incredible job of actually taking this to the next level and baking the antibiotics right into the product. So this area that you see in yellow is actually 2 antibiotics that come from the factory directly onto the product and stay there for the duration of the device. So there are multiple components here. Again, you can't see any of this from the outside, but these are components that I place on a regular basis inside the body. These are put in through minimally invasive incisions, typically one that hides in the natural skin fold that's behind the ball sack or in the perineum, and another minimally invasive incision that hides in the skin folds kind of right below or around the belt line or in the pubic hair. And that allows us to place all of these components in. There's a control pump here in the scrotum, which is where patients actually interact with the device and they give it a couple of squeezes to allow it to open. This is the cuff that fits around the back of the urethra, again, behind the ball sack, but downstream of where the prostate normally would be or is. And this provides you with that new third line of support that is closed when it's supposed to be and open when it's supposed to be. This cuff is custom fit to your anatomy. So during the surgery and through that incision on the backside of the scrotum, we're actually measuring around the urethra and, you know, within half a centimeter of that measurement, getting you a nice little tailored suit back there to make sure that you get the degree of control that you need. The brains of this operation, believe it or not, is this tiny little balloon that is, you know, maybe a little bit bigger than a peach pit that hides behind the pubic bone. And that actually applies a constant amount of pressure where the fluid or the saline salt water that's in here is keeping this cup inflated unless you actually pump the fluid out with this. And it's really just a matter of a couple of quick squeezes to help open up this cuff. It allows you to urinate and then it reinflates on its own. So people always ask, like, you know, is there an inflate and deflate button? It's far simpler than that. there's just one area that the patient squeeze. It opens the cuff up, allows you to urinate normally, and then the cuff is doing what it's supposed to be doing by mimicking the normal biological function of our urinary sphincter. I want to show you a video because I think that might be more instructive. So you will kind of watch this with me and I'll walk you through what we're seeing here. It's going to be a cartoon. So you'll see a man here, and when you look at him initially, you won't see any difference. You put on your 3D glasses or your X-ray vision, and you'll see that this is that yellow pump that we were talking about. He's squeezing it, and when that happens, the fluid that was resting in the cuff goes away. It gets nice and skinny. The plumbing is open. He peed normally, and now on its own, without any input from him, that cuff is automatically filling up, again, from the brains of the operation, which is that little balloon that hides up behind the pubic bone. And it's really as simple as that. It's a quick operation. It's quick and easy to learn. It's something that we teach in just one visit after surgery for men who have had this procedure. And then after that, they're using it without any problems and with the highest degree of confidence and control that you can have after any type of surgical procedure. So let's go ahead and talk about expectations. So a typical recovery, really from either procedure, is to expect this to be done in an outpatient surgery center. You do not have to be hospitalized for either of these. This can be really thought of as minimally as almost like a hernia repair. And it takes anywhere between 90 minutes plus or minus to be done. It's done through minimally invasive incisions. And for a sling, it's just going to be one incision that hides the natural skin fold behind the scrotum or ball sack, which is the perineum. And with an artificial urinary sphincter, it's usually two incisions, one behind the ball sack and then one within the natural skin folds around the pubic hair or the belt line. Patients can return to normal light activity really within the first couple of days of surgery. Pain is very manageable. It's like Tylenol, ibuprofen levels of pain. Opioids is not required after a procedure like this. Typically, we avoid any straining or heavy lifting for the first couple of weeks after surgery. If you have a male sling, you're really not doing anything. It's functioning right away after surgery. If you have an artificial urinary sphincter, you're just allowing surgical swelling to decrease and go away before you come in for your teaching visit, where you come in after about 4 to 6 weeks to learn how to use the device. During that time, the cuff is actually left in an open position. So there is a separate button that's used just by urologists that allows us to basically shut it off. So it's almost as if it's not there anymore. So when you wake up after a urinary sphincter, it's not working right away because I have left it off until I can teach with confidence. You can feel all the components, that you can squeeze it easily in the office. And that's typically done at that 4 to 6 week mark. The satisfaction rates for this are really incredible. So, as a surgeon, as a reconstructive surgeon who does almost completely quality of life procedures, I take a lot of time in counseling patients and making sure expectations are reasonable. This is one of the very, very few surgeries that we do across any field that we can be really confident that these things work. Okay. The satisfaction rates and the success rates for artificial urinary sphincters are incredible. Okay. The degree of control that you get, again, nothing can be as good as things were originally, right? You have to have the right frame of mind and mindset about reconstructive surgery. It is tremendously, tremendously better than men are when they're experiencing leakage. And the expectations after these procedures is to go from these coping mechanisms like penile clamps, external collection devices, diapers, thick pads, really just into safety liners that men are using mostly just for confidence, just to, those just in case moments, but are really dry most of the day. And that happens in greater than 90% of patients, which is just an incredibly high success rate for something like this. Higher than, slings that are done for women who have incontinence after childbearing. It's a really incredible and effective surgery. Cost and coverage always come up. When people hear the word elective, they're like, oh, what is this? Like a nose job? Do I have to pay cash for this? Am I going to be bleeding money out for something like this? The coverage from insurance companies for these procedures is really tremendous, right? So most of the men who are in this situation, it's because of treatments for other conditions, right? I mean, these are my prostate cancer survivors who did not do anything to put themselves in this position. They got prostate cancer, they got treatment, and now they need treatment for what comes after that. So men who have issues with control like this, it's not self-imposed, right? It's often because of treatments that came for other conditions, and insurance companies, they just get that. So the coverage for these are really quite good. If you've ever had procedures done before, you know that there's a process, you know, there's diagnosis codes, there's procedures codes. We can provide those to patients. You can reach out and really get granular with your carriers to find out not only do you have coverage, the answer to which is typically yes, but what is your out-of-pocket expense going to be for things like this? You know, we're proud to be able to offer these in outpatient surgery centers, which are typically a lower cost option compared to having things done in a hospital setting. So all you have to do is ask for those codes. We can provide them and you can get details from the insurance company. Patient testimonials are really important, right? Because, you know, I talked about earlier how this is not locker room talk. This is not something that you're talking to your buddies about while you're watching a sports game, right? This is something that is deeply personal that guys just crawl into a deep dark hole and never talk to anybody about. And that's truly, truly unfortunate, because one of the most powerful things that you can do is talk to somebody else who's in the same situation, right? So these are just some patient testimonials. So Herschel's a prostate cancer survivor who got an artificial urinary sphincter. This is his quote. "It took me from 9 pads a day to 1. I wear 1 pad because I like to laugh. It makes me feel like I can do the things I want to do with the confidence of not having to worry if I wet myself." And that's exactly what I talked about earlier, how that is the goal after surgery, is to go from whatever the heck you're using right now or before to just 1 safety liner. And that's just to give you that peace of mind that, like, hey, even if this thing like lets some through, I'm going to be covered. What does Fabio say? Fabio is also a prostate cancer survivor who got an artificial urinary sphincter. He talks more about recovery. Recovery was very easy. It took me about a week and a half where I was walking around without any pain. I walked the first week, no scarring. Remember, we used natural skin folds, and no one can tell that it's there, right? That's one of the most common questions that people have is, man, you're really putting a lot of stuff in there. Like, aren't I going to feel it? What, you know, am I going to sit on it? Am I going to know that it's there? It's really quite discreet. People get used to it very, very quickly. So just to wrap up here, summary of the benefits of these different surgical procedures. It's really just the ability to get the continence back, right? I mean, we're so used to this very simple idea of urine will stay in our body when we want it to. It will only come out when we let it. And when that reality is shattered and all of a sudden you don't know when urine might come out of your body, it changes everything. And these surgeries allow you to, you know, nothing is a time machine, right? But it allows you to get a degree of continence back that you can be confident with, where you're not avoiding activities because you're worried, right? Where you can be confident and just feel normal again. That's really the biggest benefit here. These allow you to urinate when you need to, right? They don't impede the urination in any way. They're placed inside the body. It's not something that's visible. You know, it's not something that's detectable by other people. Patients often ask, like, well, what about my partner? What about when I'm in the bedroom, right? Somebody's feeling around that. They're going to be like, what is this? You know, with an artificial urinary sphincter, that control mechanism is really quite small and it's hidden off to the side of things. So it's rarely encountered, and it's not something that a sexual partner is going to be kind of bothered by or necessarily even curious about in any way, because it's kind of tucked away from things. The patient satisfaction rates for these are really incredible. Like, I can't say that enough. All you have to do is pick up the phone and literally talk to anyone who's had any one of these things, and I can tell you with a high degree of confidence that you're going to get a happy patient. These can just kind of help return a sense of normalcy and renew people's confidence, and there's a lot to be said for that. Surgery is surgery. So let's get into some of the details and talk about what can happen during these surgeries. All surgeries have risk. We need to understand these. We'll talk about the male sling procedure first. So before we get into details, let me just start with saying the risk of major complications or any long-term complications from either of these procedures is really quite low. So when we're talking about risks and surgical complications, we're talking about more kind of minor bumps along the road that can be detected and that can be addressed. So with a male sling, it's a simpler solution, right? It's basically a piece of mesh that acts as a hammock to provide a level of support. You slide it in behind the ball sac or in the perineum, you put it underneath the urethra, and you hike it up to provide that level of support. Okay. With that simplicity comes a little bit of a higher risk of it not providing the level of degree of support that we're looking for. So device failure is what that is in reference to, is like it helps the majority of people. The majority of people are getting at least 50% better. Whether or not that's enough for you, that might fall under the category of it being a failure, right? If it doesn't meet your expectations. The device itself like can't really fail, right? These are really strong pieces of mesh. That's why we use it. It is way stronger than biological materials. Like if we were to use analogies on how we reconstruct things for women who have leakage after childbirth, we are often using pieces of fascia lata, which is that thick lining of muscle from people's thigh or six-pack muscle, to create slings, nowhere near as strong as some of these mesh materials that we use. So we're not talking about the mesh like fraying or breaking. We're talking about it just not providing the degree of control that you're looking for. Urinary retention is the inability to pee. So again, that is something that can occur in a recovery period after a sling, not something that we would expect to be a long-term issue after a sling procedure. The rates of retention are not terribly high. I think at most, if you look at large series, you're talking about maybe 10%. And again, that's a generous number, but that is temporary issues in the recovery period. I actually am mindful of that, and I typically have patients have a catheter after these procedures just to rest and as a precaution to keep you out of the emergency room. Everyone who has gotten into this situation where if they lost urinary control, again, it's usually related to some type of treatment beforehand. You had a prostatectomy, you had a BPH procedure, you had some type of brachytherapy or radiation or some type of urethral reconstruction. Guys are not strangers to urinary catheters. So having it for just a couple of nights after surgery can really help get you out of that window where you're at risk of having some difficulty with urination. Postoperative pain is really quite good. I typically don't really even prescribe opioids for these. I have people on scheduled Tylenol and ibuprofen for about 5 days after surgery. I expect you to be up and walking around and going about your business. Now, what I would say is that this is a cut behind the ball sack, right where you sit. So that can be a sensitive area, right? The way that we're designed is that our nerves in that area come from the edges, and they should stop right around here and not overlap considerably. We unzip that natural skin fold behind the scrotum to try to avoid those nerves. But people's bodies don't read textbooks. So sometimes if you get a little bit of that overlap and you tag the ends of some of those nerves, it's just sensitive, right? I mean, talk to your partners. Women who have had C-section scars, those can be really sensitive. We try to do the same thing with those as we're running right along natural skin folds, trying to avoid and go parallel and in between where those nerves are supposed to be. You tag just a little one, you can get those electric shooting pains, discomfort, increased sensitivity. If that happens, it goes away on its own, but hey, it's an area where you're sitting, so you have to be prepared if that occurs. Majority of people never experience anything like that. Irritation at the wound site, this is an area where you're sitting. You can have some skin separation there. That's really not a major issue because we close it with so many different layers of stitches that if something is separated on the outside, it's just on the outside. You can use Vaseline as a barrier ointment for that. It heals on its own over the course of about a couple of weeks. Foreign body response is really incredibly rare. So this is a piece of biocompatible material. It's made of the same stuff that we use to basically do surgery. This is made of a network of stitches or suture material. So the risk of your body rejecting it, which is a very, very common question, is almost theoretical, okay? Particularly in this area of the body, because it's going right onto a pretty beefy area of muscle. For the artificial urinary sphincter, the risk profile is a little bit different. So we're talking about a mechanical device. So like all mechanical devices, there is some risk of it failing. There's a pump, there's fluid, there's tubing, stuff like that can leak. The shelf life for an artificial urinary sphincter is another very common question. It's hard to put a finger on it, right? Because somebody could do something and break the tubing or have some type of mechanical failure because of weird extenuating circumstances like an injury or something like that. But in general, for routine use, these things are over-engineered for thousands and thousands of squeezes and years and years and years of life. I've seen people who have come back after a device failure for having these things for over 15 or 20 years. It's really incredible that a little piece of material like that can work for that long. But, it's a device. If it stops working, it's not filled with battery acid, it's filled with saline. So that's not an unsafe situation. It's just going to stop working. And for something that men rely on 24/7 to help keep them dry, people know right away when that thing stops working. They're calling me right away if their device malfunctions. Erosion of the urethra in the area of the cuff. So that's an interesting thing that really happens to the minority of patients. There are certain risk factors that we're very aware of. Men who are in their 80s, men who are poorly controlled diabetics, and men who have had radiation therapy in the past are at higher risk of having erosion of the urethra in the area of the cuff. What does that actually mean? So if you've ever seen kind of an elderly patient who's in a nursing home or in a bed, people can develop bed sores from just sitting on something for a long period of time. So this is a cuff that's like basically sitting on or around the urethra for a long period of time. And if the body underneath that is not healthy enough to kind of maintain its integrity, then you can get basically what amounts to like a bed sore around the urethra, where that material is starting to inch its way towards the inside of the plumbing where it should just be staying on the outside of the urethra. Fairly uncommon situation. If that does occur, typically requires removal of the device, a period of rest and healing before a new one can be placed. Urinary retention can also happen after a sphincter. Remember, it's a little bit more of a sophisticated device. So urinary retention can sometimes just be during that post-op period where the cuff is supposed to be open because we've kind of programmed or adjusted it in a way to be there and not functioning. Sometimes you could sit on the pump wrong and accidentally turn it back on. And then all of a sudden you don't realize it, but this cuff is closed. And while you're trying to pee, you can't. So urinary retention in a sphincter patient is usually a little bit more dynamic. It's something that can often just be resolved with manipulation of the pump. But if not, then that just requires something that can be managed with a small catheter or revision of the cuff. Infection, pain, and soreness. So similar to what I discussed previously, this is through a minimally invasive incision on the backside of the scrotum. So sometimes that area can be sensitive. Pain is really minimal. The pain associated with an AUS is similar or sometimes even less than it is for a sling because it's not anchored along the bone. It really just is slung around the urethra itself, which is not an inherently painful area. Infections for artificial urinary sphincters are really quite rare. And again, this is related to that antibiotic coating. It's called inhibizone, but it's really a huge advance by Boston Scientific to actually have antibiotics baked right into the coating of this device. And that has really dramatically reduced the risk of implant infections. Still neurotic, still do everything that I can to help prevent those. You scrub your body with an antiseptic soap the night before and the morning of the procedure. I personally scrub your body with an antiseptic twice before I make any incisions on the skin. I'm having the anesthesiologist give you 2 different IV antibiotics that go in and are circulating in the system before any of the surgery is actually done. And then it's not uncommon to use antibiotics afterwards, at the time of catheter removals and things like that. So we still do all the precautions that we can. But again, the coating, I think, does really most of the work. And this is not meant to be like a comprehensive discussion of surgical risk, right? This is just meant to address some of the most frequently asked questions. You want to know what you're signing up for, right? But this is an opportunity for you to have a really detailed and personalized discussion based off of your individual risk and risk factors with your surgeon. So to wrap things up here, urinary leakage, it's a known side effect of treatment, whether it be prostate cancer treatment for benign prostate enlargement, or reconstruction after certain types of trauma or injuries. There's a variety of treatment options out there that range from just behaviorally managing it to, addressing it non-surgical, non-medical with pelvic floor exercises and strengthening, coping mechanisms to help control and catch that urine when it does leave the body. And then again, more durable and permanent long-term solutions to actually address the problem and the root cause head on with either the male sling procedure or the artificial urinary sphincter. That, the way that I describe it is it provides you with a new third line of defense when one of those first two were compromised from prior treatments. These are short recoveries. These are outpatient surgeries that we do on a regular basis. The sling or the sphincter can be a great solution for you. Finding the one that's right for you just involves starting that conversation with a skilled surgeon who can offer you both of these procedures. I'm happy to make appointments for people and get people plugged in with me in the Germantown office. I do these on a regular basis, and we can start with talking about what an evaluation looks like. One of the first steps is just understanding the amount of leakage. So oftentimes we're talking about situations in which you may leak, how much you leak, how you cope with it in terms of the number and amount of incontinence products. And then after that, actually doing a more individualized evaluation where I'm looking inside, I'm seeing how well that sphincter can open and close. I'm looking to see what the anatomy looks like after the treatment that you've gotten, and then also doing more functional testing, filling up the bladder and looking to see how much leakage happens if I have you stand up, if I have you cough, if I have you do some jumping jacks. I want to see what we're dealing with here, because as a reconstructive surgeon, that's all of the homework that I'm doing to make sure that I'm not only proposing the right solution for somebody, but learning all of the nuances that I need to do the surgery at the highest level. So these are just some references. There's, again, a really a glut of high quality information out there. If you can go back to the initial slide where there was a QR code, you can get access to all of these references and more. There's great patient testimonials. We also have the ability to connect you with what are called patient advocates. So like I said, this is not something that you may encounter while you're, chatting with a friend, during a sports event. This is something that you probably want to use a medical network to get connected with somebody who's really been in the same situation as you and can talk to you about what the experience has been like. So just talk to your doctor about that. We have resources available. This is my information. Devang Sharma. I'm with Chesapeake Urology. I see patients in the Germantown office, and I'm our region's designated prostate cancer survivorship specialist, do artificial urinary sphincters and male slings on a regular basis, and happy to start the discussion and evaluation for anyone who's suffering from this condition. This is the phone number for scheduling an appointment. I want to thank everybody for the attention. I know that I can probably talk all night about things like this. It's just because I'm passionate, about taking care of my community, taking care of prostate cancer survivors and everybody else who's affected by this condition, and really about these solutions that we have to really help regain confidence and control for men who suffer from these conditions. So let's turn it over to really the live portion of this event.